Well, if you are bothered by having to take frequent bathroom breaks, you're not alone. Bladder problems are common in men and women. Focus at 4's Linda Mays shows us how doctors are now using a common wrinkle remover to help some patients find relief.
This small box contains relief for what millions of American men and women deal with daily as an embarrassing but quality of life issue. OAB, overactive bladder.
You get a sudden urge to go and you can't control it. I mean, it hits you all of a sudden where you just have to use the restroom. Before you can stop that urge or keep it calm and walk to the bathroom, you're leaking.
Wanda Boyes is familiar with OAB, also known as urge incontinence.
I would feel the urge to go to the restroom, and I had to go. If I didn't, I would start to leak.
66-year-old Boyes tells us her experience in hopes of helping others address their bothersome bladder problem. Boyes, an active church volunteer, was referred to a urologist to learn more about the new option after medication didn't work for her. BOTOX gained popularity as a facial wrinkle reliever. It recently received FDA approval to treat the urgency and frequency of overactive bladder symptoms when oral medication doesn't work well enough or can't be taken.
It temporarily calms the bladder so that it's not firing so much, so you're not having those sudden urges or leakage episodes. Just like when you give it to the muscles in your face, it's the same thing. The bladder is a muscle.
So the contrast, the kidneys are starting to empty. And here's 5 minutes, 15 minutes, they're starting to collect contrast. And then the patient is asked to urinate. So obviously there's still some draining into the bladder.
BOTOX can be used to treat overactive bladder in both men and women, but retaining urine is one factor that may rule out a potential patient. Urologist Dr. Nicole Massie shows us how a cystoscope is used in the in-office procedure.
The BOTOX is delivered through the cystoscope, which may be a flexible or a rigid.
We are able to inject the BOTOX material into the bladder through a very long needle, and we can do individual injections into the bladder.
A local anesthetic is used on the bladder for the 10-minute procedure. Medicine to relax you helps.
And it's a little uncomfortable, a little pain, not excruciating, and it only lasted probably a minute.
Possible side effects include unpredictable leakage, but urologists say wait at least 2 weeks to see results. However, Boyes says she resumed her normal activities the next day and didn't feel an urge to go. After BOTOX put a temporary hold on Boyes' overactive bladder for 6 to 10 months, Boyes has her freedom again.
A new way of life and being comfortable when I go out, and I can feel like I can go and not have to worry that there's a restroom. And
yeah, you shouldn't have to worry.
No, you shouldn't.
No, thanks to Wanda Boyes for sharing her story. Now, the BOTOX bladder procedure is a temporary fix, so Mrs. Boyes says that she'll be making an appointment for another BOTOX injection when she feels the urge, no pun intended.
Yeah, absolutely. Well, is there anything different for the treatment of men, Linda?
Well, now, they do use the flexoscope. Urologist Dr. Andrew Strain, he tells me that 6% of the males have difficulty voiding, and so they make sure that that voiding issue isn't a prostate issue. So really the procedures are practically the same for men and women.
Okay, well, and I'm guessing if you use BOTOX for your bladder, it doesn't help your wrinkles at all.
It doesn't help the wrinkles at all.
I had a feeling you couldn't have it all for that. All right, thanks, Linda. We'll be back in just a moment.